Ever pondered the significance of your liver to your overall well-being? Your liver is a powerhouse conducting over 500 imperative functions. The possibility of damage is always present due to a multitude of causes that can affect its structure and performance. Grasping the fundamentals of liver health is a must to prevent any potential harm and to recognize the best treatment approaches. Now let's deep dive into the causes, symptoms, methods of detecting, and the various treatments for liver damage. And remember, the key to your health lies in your own hands. So, what causes liver damage? Well, liver damage can spring from a variety of sources. One of the most common culprits is excessive alcohol consumption. Over time, chronic alcohol abuse can result in what's known as alcoholic liver disease. This condition can lead to inflammation and fatty liver, and in severe cases can progress to cirrhosis, a condition where the liver is so scarred it can no longer function properly. Next, we have viral hepatitis, specifically hepatitis B and C. These viruses pose a significant risk to liver health. They can cause inflammation and damage to the liver over time, which if left untreated could lead to serious conditions like cirrhosis or even liver cancer. Then there's non-alcoholic fatty liver disease, or NAFLD for short. This is a condition characterized by the accumulation of fat in the liver that's not related to alcohol consumption. Risk factors for NAFLD include obesity, insulin resistance, and metabolic syndrome. Certain medications, toxins, and environmental pollutants can also affect liver function adversely. These include over-the-counter drugs like acetaminophen, certain antibiotics, and industrial chemicals. Overuse or prolonged exposure to these substances can be harmful to the liver. Finally, let's not forget autoimmune diseases. Conditions such as autoimmune hepatitis can cause the immune system to attack healthy liver cells. This leads to inflammation and liver damage, further compounding the problem. It's important to note that these causes often interact and overlap. For instance, someone with viral hepatitis who also abuses alcohol is at a much higher risk for severe liver damage. Understanding these causes can help you avoid them and maintain a healthy liver. It's all about being mindful of your health habits and making informed choices. Remember, your liver is a vital organ that plays a crucial role in numerous bodily functions. By keeping your liver healthy, you're investing in your overall well-being. So, take care of your liver, and it will take care of you. How can you tell if your liver is damaged? This question often crosses the minds of many, given the liver's pivotal role in our body's overall health. It's important to understand that liver damage doesn't just happen overnight. It is usually a gradual process that can take many years to manifest, but when it does, certain symptoms may start to surface. One of the most common signs of liver damage is a general feeling of fatigue and weakness. This is not just your everyday tiredness, but a persistent lethargy that doesn't seem to shake off even after ample rest. It's your body's way of telling you that something is not quite right. Another noticeable symptom is jaundice, which is characterized by the yellowing of the skin and eyes. This happens when the liver is unable to efficiently process bilirubin, a byproduct of the breakdown of red blood cells. When bilirubin builds up in the bloodstream, it can give the skin and eyes a yellowish tint. Abdominal pain and swelling can also point to liver damage. This discomfort usually occurs in the upper right part of your abdomen, which is where your liver resides. The swelling, or ascites as it's medically termed, is due to a buildup of fluids in the abdominal cavity, often a consequence of severe liver disease. Nausea, vomiting, and loss of appetite are other symptoms that may signal liver damage. These are often accompanied by weight loss due to reduced food intake. Changes in the color of your urine and stools can also indicate liver problems. Dark urine is usually a sign that bilirubin is being excreted through the kidneys, while pale stools may suggest that the liver is not releasing enough bile into the digestive tract. Remember, these symptoms may not always point directly to liver damage and can often be signs of other health conditions. However, if you notice any of these signs, it's crucial not to dismiss them. If you notice any of these symptoms, it's important to seek medical attention promptly. Your liver is a vital organ, and taking swift action could be the key to preserving its health and your overall well-being. How do doctors diagnose liver damage? Let's delve into the process. Diagnosing liver damage is a multi-step procedure that involves a comprehensive review of the patient's medical history, a thorough physical examination, and a series of diagnostic tests. This holistic approach ensures that doctors gain a complete understanding of the patient's health status and can accurately identify any signs of liver damage. The medical history review is the first step. Here, doctors gather information about the patient's past and present health conditions, lifestyle habits, medication use, and family history of liver disease. This information helps doctors identify potential risk factors and symptoms that could point to liver damage. Next comes the physical examination. Doctors will look for visible signs of liver damage such as jaundice, which is a yellowing of the skin and eyes, or an enlarged liver that can be felt during a physical exam. They'll also check for signs of fluid buildup in the abdomen, a condition known as ascites, which can be indicative of serious liver disease. The diagnostic process doesn't stop there. Specialized tests are required to confirm the diagnosis and assess the extent of the liver damage. Blood tests are often the first line of investigation. These tests measure levels of certain enzymes and proteins in the blood that give insight into how well the liver is functioning and can help detect markers of liver damage. In addition to blood tests, imaging studies such as ultrasound, kinetic scans, or MRI are used to visualize the liver and assess its condition. These imaging techniques can reveal structural changes in the liver, such as scarring or tumors that are indicative of liver damage. In some cases, a liver biopsy may be necessary. This procedure involves taking a small sample of liver tissue and examining it under a microscope. A biopsy can provide detailed information about the degree of inflammation, fibrosis, or other abnormalities in the liver. The diagnostic process for liver damage is meticulous and thorough, ensuring that doctors can make accurate diagnoses and formulate effective treatment plans. Early diagnosis can lead to more effective treatment and better outcomes. So, if you're experiencing symptoms that concern you, don't hesitate to consult with a healthcare professional. Now let's talk about how liver damage is treated. The treatment for liver damage is as diverse as its causes. It's crucial to understand that the best course of action depends on the underlying cause and severity of the condition. There are three main categories of treatment: lifestyle modifications, medications, and liver transplantation. First, let's delve into lifestyle modifications. If the liver damage is due to alcohol-related factors or non-alcoholic fatty liver disease, lifestyle changes can significantly improve liver health. Abstaining from alcohol is a no-brainer for alcohol-induced liver damage, but it's not just about removing the bad stuff. It's also about incorporating the good. Adopting a healthy diet, rich in fruits, vegetables, lean proteins, and whole grains, can aid in liver recovery. Regular exercise also plays a key role, helping to maintain a healthy weight and reduce fat accumulation in the liver. Next, we have medications. Now, these aren't your run-of-the-mill over-the-counter pills. These are prescription drugs specifically designed to manage symptoms, reduce inflammation, or slow the progression of liver disease. For instance, antiviral drugs can be effective in treating viral hepatitis, while corticosteroids may be used in cases of autoimmune hepatitis. It's important to remember, though, that these medications are not a one-size-fits-all solution. They should be taken under the supervision of a healthcare professional who can monitor their effectiveness and manage any potential side effects. Finally, there's liver transplantation. This is the big one. In cases of advanced liver disease or failure, a liver transplant may be necessary. It's a complex procedure where a diseased liver is replaced with a healthy liver from a deceased or living donor. It's not a first-line treatment, but it's a life-saving option for those in dire circumstances. Remember, the best treatment plan for you will depend on your individual circumstances. It's critical to consult with a healthcare professional who can guide you through this journey, tailoring the treatment to your specific needs and monitoring your progress along the way. In conclusion, liver damage is a serious health concern. We've walked through the multiple causes from excessive alcohol consumption and viral hepatitis to non-alcoholic fatty liver disease and exposure to certain medications and toxins. We've also touched on how autoimmune diseases can prompt the body itself to inflict harm on the liver. Symptoms of liver damage are diverse, ranging from fatigue and weakness to more visible signs like jaundice. Diagnosing liver damage is a multi-step process, incorporating medical history review, physical examination, and various diagnostic tests. Treatment options are dependent on the root cause and severity of the condition, but can include lifestyle modifications, medications, or in severe cases, liver transplantation. In essence, understanding liver damage and its implications is crucial. It empowers individuals to take proactive steps in preserving their liver health. If you suspect you may have liver damage or are at risk, don't hesitate to consult with a healthcare professional. Remember, your liver is essential to your overall health, so take good care of it. Thank you for joining us on this informative journey about liver health. We hope you found this video informative and helpful. To stay up to date with more health-related content like this, please consider subscribing to our channel. Your support helps us to continue providing valuable health knowledge to our community. If you found this video helpful, please give it a thumbs up and share it with your friends and family. Knowledge is power, and by sharing, you are empowering others to take control of their health. Remember, your health is your wealth. Stay informed, stay healthy.